My name's Brad. I'm a nurse anesthetist here at Prairie Lakes Hospital, more commonly known as a CRNA. A CRNA is a nurse who has advanced anesthesia training and gives anesthesia in the operating room. When you come to the same-day surgery area and are admitted by the nurses there, you will be evaluated medically by one of our anesthesiologists. They'll ask you the medical-type questions, talk about your previous surgical experiences, listen to your heart and lungs, and they'll fill out a pre-op form. When it comes to the appropriate time to bring you back in the operating room, myself or one of the other CRNAs will be there to meet you, introduce ourselves, greet your family, and at that point we'll answer any questions that you or your family might have about the procedure or about what's going to happen. You and I will walk back to the operating room, and I kind of enjoy this time with the patients because it's before I administer the anesthesia. I can visit with them a little bit. We can talk about any further questions they might have or clarification, and I can get to know them and find out a little bit about past experiences that they've had with surgery and anesthesia as well. When we walk into the operating room, it's probably going to be a place that you've never experienced before. Everybody is gowned and gloved up and sterile. There's lots of instruments that will be laid out. And our gas machine is something that you're going to see right away when they enter the room. Gas machine can be kind of a monstrosity to patients that aren't expecting that sort of thing, but it is just critical in the safe anesthesia care that we want to be giving the patients. No matter what type of anesthesia the patient will be having delivered, whether it's sedation or spinal anesthesia or a general anesthetic, we'll be monitoring the exact same modalities and vital signs on the patient. In other words, we'll be watching the patient's blood pressure, the EKG heart rate and rhythm. We'll be watching the oxygen levels very carefully to make sure that the patient is undergoing a very safe anesthetic. During the time that you are sedated or fully asleep, we'll be giving you the appropriate medications to take care of your pain needs going into the post-op area, as well as giving you medications. So hopefully you won't experience some of the side effects of some of the things that we'll be giving you to keep you asleep and safe. After the surgical procedure is done, we'll transfer you onto a cart and then take you down the hall to the recovery room. At that point, the recovery room nurse will be there to take over the patient, but before I sign off, I'll tell them the patient's name, tell about the surgical procedure, the physician, and any pertinent facts that I want to pass on to the recovery room nurse, like allergies or their personal health history, as well as what I did in the operating room, pain medications, anti-nausea medications, and the different drugs that I've administered to the patient. When I sign off, the nurse then takes over at that point, but we're available at all times for consultation or further clarification from the recovery room nurse. I find that Prairie Lakes, over the years I've been here, 28 years, is very unique in that it is a community hospital. It's staffed by community people that really care about you as a patient and a person, and you really are our neighbor here, and we've probably seen you in the community when you come to the hospital to have your procedure. And so we can, we're kind of like a family in that regard, that we're small enough to many times know you by name, but large enough to provide most types of medical care that you need right here in Watertown.